This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good morning. Welcome into the program. Hope your week is off to a fantastic start. I'm Dave Wilson. Behind the controls, Sarah Giossi with me as always. Good morning, Sarah.
Good morning.
Ready to get the week rolling?
Let's do it.
All right. Dr. William McBee joins us in studio this morning. Gynecological oncologist, surgeon at Mon Health Cancer Center. Good morning, Dr. McBee.
Good morning. Thanks for having me.
Well, thanks for coming in today. We appreciate it.
Absolutely.
All right. Before we get into all the medical stuff, that's a technical term, by the way, Sarah. Medical stuff.
Stuffs.
Let's know a little bit more about you, where you come from. Now, you're an original Morgan. Is it Morgantonian, Sarah?
Yeah, I'd go with that.
You're a townie.
That's
what
fine.
is it? Morgantonian.
Yeah, Morgantonian.
You're from here.
Yeah,
That's where I was going.
I'm from Morgantown. I grew up just right off Pierpont Road exit, just on that end of Canyon Road, and lived there until I went to obviously school here, and then went to high school, Morgantown High, and then I went to WVU for undergrad in medical school. And then I went to Cleveland and did a combined program between, it was a Case Western Metro Health Medical Center Cleveland Clinic program and OBGYN. And then after that, went to McBee in Pittsburgh for gynecologic oncology, and then finished that in 2010 and came back to Morgantown when I finished fellowship.
So what led you into medicine to begin with? What started you down this career path?
Yeah, I honestly can't remember. For as long as I can remember, I wanted to be a doctor.
Really?
Yeah.
I wish I could. I switched about 3 times growing up. I was going to be Batman.
Cowboy.
Yeah. Big league ball player didn't work out very well for me.
Yeah.
Ended up here.
My dad was a police officer. I knew pretty early on I probably didn't want to do that, but yeah.
So what led you to Mon Health and the practice you're currently doing?
Yeah, so when I came back to Morgantown, I mean, I looked around. I looked at going back to Cleveland. I looked at staying in Pittsburgh, but I really wanted to come back to Morgantown. I have 4 kids, and I always enjoyed growing up in Morgantown. I thought they would as well. So I looked to come back to Morgantown, and when I came, I obviously looked at a couple different options, but I was actually born in Mon General, and that's just the hospital that everyone has always gone to for as long as I can remember, friends, family. So it was kind of a natural fit. And when I came back to Morgantown, there wasn't a good fit as far as what I do practice-wise, but I grew up with Dr. High School's family, as a kid. So I actually just called Dr. High School up one day and said, hey, I want to come back to Morgantown. I really don't have a place to practice. And he let me join his practice for a couple of years and did a lot to really get my practice built up. And so I was with him between 2010 and 2012. And again, if it weren't for all the work that him and his group did to get my practice started, it wouldn't have worked out at all. But then my partner came down she's from Washington, PA, and was 2 years behind me in McBee, and she joined me in 2012. And it was kind of a natural fit, or just kind of a nice progression to separate from Dr. High School's practice, because it's a general surgery group, and again, they were nice enough to give me a place to stay for a couple of years, but it made more sense to kind of branch off and form our own practice at the hospital. Even though while I was with high school, I was at Mon General exclusively.
The whole time.
Yeah.
And so why specifically, again, you were at a practice where there was general, why specifically go into gynecologic oncology?
As far as the working with Dr. High School, that was, again, that was a place to practice and see patients and, administrative stuff to help get things running, as opposed to just trying to do it all on your own, which would have been impossible. But why I chose gynecologic oncology, in my opinion, it's the perfect specialty with a mix between medicine and surgery. So we do a lot of surgery, probably as much as anybody or as any subspecialty. But in addition to that, we also follow patients for a very long time. So I'll see patients forever. I mean, so as soon as they get diagnosed with a disease until we cure them, or they're in remission, or unfortunately they may pass away, or whatever the case may be. So we get to follow patients for a really long time. We do all of our own chemotherapy, do most of our own medical treatments. And it's a little bit different. Most specialties either do one or the other. If you're a surgeon, you do surgery and you kind of give the patients back to their other doctors, and And obviously, medicine doctors don't do surgery, but we get to do everything, which is really nice.
We're going to jump into the aforementioned medical stuff coming up on the other side of this break. We're visiting with Dr. William McBee. We're going to get into what kind of, what you treat, what kind of conditions, what kind of treatments you offer, all of that as I can encompass into the term medical stuff. We'll do that on the other side of the break. Dr. William McBee, gynecological oncologist surgeon at Mon Health Cancer Center. You're listening to Mon Health Talk on the voice of Morgantown, WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, call now at 304-296-0041.
Joining us in studio this morning is Dr. William McBee, gynecological oncologist surgeon at Mon Health Cancer Center.
So, Dr. McBee, what does that mean? What kinds of conditions are you seeing on a day-to-day basis, and what do you treat?
Yes, we take care of women with gynecologic malignancies or pre-malignant conditions. So essentially uterine cancer, cervical cancer, ovarian cancer, and vulvar and vaginal cancer. And also, again, what that goes along with that are precancerous conditions of those organs.
What would you say is the most common thing that you see coming in?
From a cancer standpoint, endometrial cancer is the most common. It's essentially cancer of the lining of the uterus, and by far and away, that's our most common cancer that we treat. We also I do also benign gynecologic surgery. I get a lot of referrals from OBGYNs for various reasons. Sometimes they don't do surgery. Sometimes the patient may be complicated for a variety of reasons. So we do a fair amount of benign gynecologic surgeries like hysterectomies and things. Everything we do is minimally invasive for the most part, except for some of the bigger belly surgeries that end up being essentially patients that have tumor that's spread throughout the abdomen. Those end up being big open surgeries, but 99% of everything we do is minimally invasive, either laparoscopic or robotic.
And so are those new treatments that you're talking about there whenever we start to talk about the minimally invasive? Again, this blows our minds every time we have this conversation, the fact that you could have somebody come in and how you're able to do these surgeries now and how quickly recovery goes. It blows my mind.
Yeah, it's much, much better. I mean, I wouldn't say they're new. I mean, they're newer. I don't think we were doing, clearly we do more, each year we do more and more, but over the past 10 to 15 years, throughout my training, we've done it. So, I started residency in 2003, and at least for that long, everything pretty much. And I also was trained at places that's all they did. At Cleveland Clinic, everything was minimally invasive. So, I mean, they were probably a little bit ahead of the curve, but in this day and age, it's really the standard of care. I mean, before I came in here for the radio show, I did a hysterectomy on a lady that'll go home, 2 hours after the surgery. So and the recovery is night and day different. Yeah.
One of the things we joke about on this program is we hope we never have to see you. No, I probably would never have to see you, obviously, but you get what I say. So, what part of your role does prevention in looking for these certain types of things that could crop up down the road? What role is that in your practice?
Yeah, I mean, from a gynecologic oncology perspective, the most important things are weight control. Certainly, a lot of these conditions are caused by being obese. I mean, or impacted by being obese. Kind of healthy lifestyle certainly helps. Cervical cancer is a completely preventable disease. We way under vaccinate kids with the HPV vaccine, which in my opinion is kind of ridiculous. I mean, so you have a cancer that you can prevent, and actually not only cervical cancer, but anal cancer, vulvar cancer, head and neck cancer. It's now the number one source of head and neck cancer. So, these are all preventable cancers if we vaccinate kids when they're 10, 11, 12 years old. So, so that is what you can do. Again, and other than that, just kind of having this healthy lifestyle and following up with the doctor. If you have a problem, don't blow it off. See somebody about it and find out what's going on.
And having your annual exams with your OBGYN.
Yep. And
so
talk.
Those basics.
If you have an issue, let them know. Or her know, whoever know.
Well, yeah. and I think that's important because, again, whenever we start to talk about this world, as opposed to talking about heart health or lung health or any of these other things, sometimes people get a little more anxious or embarrassed or nervous to speak to their physicians about some of the things that they're experiencing. But that's a huge part of having this relationship, right? And that's why Mon Health is so good, because you're developing a true relationship where you can talk about it.
Yeah, I mean, a lot of our providers are from this area. I mean, and they've been practicing for a very long time, and they're very good. So certainly, if you're not comfortable, or if you go to see the gynecologist and you have multiple people come in throughout the course of your visit, you're not going to be nearly as open. Or if you see a new face every time you come in, and again, nothing wrong with training programs. I mean, they're very necessary, and I'm a product of big training programs, but for a subject, a topic like this, it's nice to be comfortable and be able to be open with your physician and not worry about seeing a new face every time you come in.
Dr. William McBee, gynecological oncologist, surgeon at Mon Health Cancer Center. Also, how much of your job is information and education? You mentioned the vaccines. You mentioned there are steps you can take. Cancer, I've always thought of as one of those things that it could happen to anybody, and it just happens, and there's nothing you can do about it. Just what you told me, there are steps you can take to prevent it, and how much of your job is to educate people, to let your patients know there are steps you can take out there, very, relatively young.
Yeah, for sure. I mean, a lot of our job is education, and sometimes by the time that a patient's gotten to us, like they've already have cancer. So, but for example, endometrial cancer, the biggest cause of endometrial cancer is obesity. So, I can cure the vast majority of endometrial cancer, with an hour surgery, but the patient at the end of the day is still obese and still has increased risk of heart disease and multiple other medical problems. So to educate them that this is what led to this problem, and if they don't, if they don't kind of get control of themselves, then they're going to have all these other problems down the road. It's certainly a great opportunity to educate patients.
Talking to Dr. William McBee, gynecological.
Every time.
He's an oncologist at Mon Health Cancer Center. We'll continue the conversation. We've touched on it a little bit, that holistic approach, that individual treatment plan. We'll talk about why that is important when we return on the other side of this break. You're listening to Mon Health Talk right here on the Voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our Mon Health guests, call now 304-296-0041.
Dave and Sarah in studio, of course, and joining us is Dr. William McBee, gynecological oncologist, surgeon at Mon Health Cancer Center. And Sarah, we talk about this every Monday, no matter what treatment we're talking about. You're not going to come to Mon Health and get a one-size-fits-all, box store style type of a treatment. Oh, you have this, so this means you get that. You're going to get an individualized treatment plan based on who you are, your condition, your health, your whatever's going on. And that also applies here, Dr. McBee, that whatever it is that you're trying to deal with or you're going to treat, you're going to sit down and look at this holistically. And again, not just go, well, you have this, so that means you get X amount here.
Yeah, absolutely. I mean, and the other thing to consider too is our patients come from all over the state and all over the region. So, the treatments are very different. I mean, the surgery may be similar, but we don't do the same surgery for every patient. Sometimes if they need additional treatments like chemotherapy or radiation, we're more than happy to refer back to their local hospital. So that's a major key. And then also just after we do surgery first, after we've done surgery, treatment varies depending on what their stage is, what the grade of the cancer is, and what type of treatments they need. And again, we also individualize those based on, again, everything, age, future fertility desires. There's thousands of different ways treatments may go.
This is the case with pretty much any medical care. I think an argument could be made, but in particular, whenever you're dealing with oncology, and I would say even another step further with gynecologic oncology, there is such an emotional side to all of this. And talk to me a little bit about how that plays a role in your life.
Yeah, I mean, absolutely, because, women are the caretakers of families. So when, whether it's a younger woman and, someone's daughter gets sick, or when it's an older woman and someone's mother or grandmother gets sick, it's very emotional because, the whole family becomes involved because everybody's worried about them.
And I imagine there has to be some conversations depending on what the particular situation is about fertility and, what the future looks like and all of those pieces too that, again, can be a really emotional topic.
Yeah, I mean, it's not like every surgery we do is taking everything out.
Absolutely.
I mean, a lot of this stuff is very tailored towards if they want to have kids in the future, but not only kids, if they don't want to go into menopause early. So sometimes you may decide to take out the uterus because they're done having kids, but they may not want to lose their ovaries. I mean, so there's very individualized treatment depending on age and all those other factors.
For the community as a whole, what's the benefit of having you in town, in your practice in town, services like this available right outside our back door?
Yeah, and not only myself, but pretty much all the physicians at Mon Health Medical Center, I mean, are extremely well-trained physicians. I mean, a lot of them are from the area. They've been here for a very long time, and then we just take excellent care of patients. So I think you really get the same quality care you would get at any tertiary center in the country, in Morgantown.
Like we always talk about, Sarah, right here. You don't have to go, you don't have to travel 6, 7, 8 hours away. It's these services available right here in Morgantown.
Well, and there is something to that, homegrown health. So, there you go. A new slogan for you guys, homegrown health. Because we were talking, you mentioned in the very first segment, you were born at Mon General. I was saying I was born at Mon General. My mom was born at Mon General. There's something really connecting on a human side for the patients that come there, because it's like almost like you're a part of the family.
Yeah, and not only that, I mean, I think the administration has really put together a great group of providers. I mean, it's nice to go to the place you were born, but it's also nice to go to the place you're born and know that you're getting as high quality care as you could anywhere in the world. So they've done a very, very good job of staffing the hospital, and not only the physicians. I mean, the nurses, the nurse practitioners, the physician assistant. I mean, everybody is really top notch and really caring. It's clean, it's nice. Everybody from the person that cooks the food to cleans the floors, everybody is just friendly and outgoing and really has the patient's best interest in mind.
Got about 90 seconds here before we hit the top of the hour. Can patients contact you directly, or are they going to be referred, need to see their primary care physician first?
Most patients get referred. But that being said, if I do certainly patients that want to be seen by me, I'm more than happy to see them. They can contact my office. The phone number is 304-285-3870. But most of the time they start with their primary care provider and or their gynecologist and then get referred for that way, because a lot of these things too, to be honest with you, are better handled by their primary care provider or their primary gynecologist, as opposed to myself, who's a little bit more specialized in surgery and cancer care.
Got about a minute to go here, and just quickly want to mention again, and you kind of referenced it there for a moment, the outreach services that Mon Health does have as well, because my opinion, with no medical background at all, if you have a good attitude, if you have that support system, whether it's other patients who are going through some of the same things you have, or just having somebody that you can vent to who knows what you're going through, it goes a long way in helping with your treatments.
Yeah, and it's not just myself. And we have a great team. My partner, Dr. Lesnock, and we have 2 nurse practitioners, Jess Four and Sarah Prophet, and we all work as a team. And again, it never happens with one person. I mean, it's a group effort for sure. And then not only those folks, but all the other persons in my office, the medical assistants and nurses, everybody works together as a team.
Dr. William McBee, gynecological oncologist, surgeon at Mon Health Cancer Center. More information, monhealth.com/cancer. You laugh, Sarah. Go ahead and laugh it up over there. Thanks for stopping by this morning. We appreciate it.
Thank you for having me.
Coming up, it's the top of the hour, Fox News local news, and the talk of the town on the way next on WAJR.